I just want to give people some information and update people on the position that we find ourselves in with the provider of care for Millvina and Brushwood care facilities that we opened last year in partnership with Shaw Healthcare. We, as we made clear, built these two facilities and leased them back, rented them back to Shaw Healthcare. We felt it was a good thing to do because it provided dementia care for people in two of the communities within our city, North Liverpool and South Liverpool. And we were really pleased and honoured and delighted to be able to do it. We borrowed the money from the Public Sector Works Loan Board, and the company were paying that loan back. Unfortunately, COVID has struck, and it's meant that Shaw Healthcare are not able to carry on providing the care and work that they were doing in these facilities to the residents of the facilities. And we're really upset and deeply shocked by that. However, there are now 600 spare places within Liverpool as a result of COVID-19. Now, I understand and really feel well, embarrassed but also upset that we find ourselves in a position where we can't save the facilities as they currently are, because one, we were charging the providers £500,000 to pay back the loan. We would lose that if we were to run it ourselves, but equally we would have to pick up the costs of around about £2 million a year. And we just simply can't afford to do that because, you know, the financial position that Liverpool City Council's in. So it's really a difficult position for us, a really heartbreaking position for us to find ourselves in. And I understand the anger and the frustration that the families of those that are in these facilities must feel at this current time. What I can say to you is that, you know, we, when I became the leader of the council in 2010, used to get £222 million for adult social care from central government. Today, that's around about £176 million. And, you know, we've had to use our reserves to pay for adult social care around about £13 million a year. And we just can't no longer afford to do the things that we need or would like to do. We simply haven't got that money. So for me to pick up and take on an extra £2.5 million onto our budgets every year just means that we would have to close facilities, whatever they may be, you know, libraries, leisure centres, children's centres, whatever. We just have no money. And so we're in a really awkward and difficult position. We're working with other health providers to see if the facilities can be kept open, not for dementia, but we're working really hard with the families and with other providers to find spaces and places for the people in there. We were proud, I was proud, it was me that led this initiative to actually create new spaces. And I stood there and opened up these two facilities last year and was so proud and honoured to do so. And I know how touched the families were by what we had achieved. It was innovative, it was creative, it was the first of its kind, where as a council we'd been able to do that. But, you know, we have to remember and hold the government accountable here. That, you know, £70 million a year, that, well, and it's a year that we've lost for adult social care. And the fact that Boris Johnson and his government said that they would fix social care, it still hasn't been done. We're going to see more and more facilities closed. If you remember, last year we lost James Nugent Court, that lost £3 million. We've seen Edinburgh Park and Clubmoor close. We've seen Amberley House in Fazackley close. 3 facilities closed last year because they simply couldn't cope through finances. We're going to see more of that, and this government have to take responsibility for the plight of adult social care that we find ourselves in as a city. I'm heartbroken, seriously. I'm heartbroken by the choice that we've had to make here. It's not something that I want to do. The very idea that we would want to close facilities down after we opened them up 12 months ago, it's just an anathema to me. It's something that is one of the most difficult things that we've faced as a city. But I hope we'll be able to provide care for the people in there in other facilities, and we will be able to keep these facilities open within the NHS, within providing a care setting, and we hope to try to see if we can save as many jobs. But the blame for this, I have to say, lies firmly at the door of the government. And if there's anything we can do, and we're still trying to engage with them and talk to them about the plight we're in, then we'll continue to do that. But as I said, I just wanted to explain and give you an update on the reasons why we're in the position that we're in.